Hello everybody, I am Dr. Vikas Singhal, Associate Director GI Bariatric Surgery at Medanta Medicity Hospital in Gurgaon. So I wanted to talk today about the advantages of robotic assistance for hernia surgery. So patients now come to us asking for hernia surgery, and where really is the advantage, or who should consider a robotic assisted surgery. So we know that robotic surgery is bit more expensive than the usual laparoscopic surgery, especially more expensive than the open surgery. So of course this question comes that, do I really need robotic surgery, or when should I consider robotic assistance for hernia surgery? So I wanted to tell you about that. So the main advantages of robotic surgery is that the robot gives us 3D vision. So it is almost like we are looking inside and looking at the organs directly in 3 to 4 dimensions when we are doing the surgery. The second advantage is that the movements of the robotic arms are very precise. So they are almost 270 to 360-degree range of motion of the robotic arms. So when we are doing the hernia surgery, which is often on the what we call the roof area, or the belly area, or the roof of the belly, then conventional laparoscopy is sometimes difficult because we have to suture, we have to put stitches on the roof, which is difficult with simple instruments. That is where robotic surgery gives us a lot of advantage. That of course, the surgeon is doing the surgery. It is not that the robot is doing the surgery, but when we are sitting on the console, our movements, जो हमारे हाथों के movements होते हैं, वो exactly patient के अंदर same movements replicate होते हैं. So definitely for hernia repair, I would, especially some complex hernias, even inguinal hernias, incisional hernias, I would recommend robotic assistance, because it gives us a lot of advantage, more precision, and at the same time it results in less pain. So for the patient, it translates into less pain and faster recovery. Often we are, instead of using tacking devices, we are able to stitch the mesh and do most of it by suturing. So to summarize, that is the main advantage of robotic assistance for hernia repair. And if it was me, I would definitely consider robotic assistance for hernia surgery.